Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the CU Public Health District. Hi, Julie.
Hi, how are you?
I'm doing okay, but I have a lot of questions for you this week, as I do every week. Let's
Okay.
talk about vaccines to kick it off. Moderna came out today saying that they have a vaccine that is 95 to 96% effective. That coupled with Pfizer's vaccine, does that mean that we could have double coverage, two companies out there vaccinating quickly, and this could speed things up?
Well, there's several of the RNA vaccines that are under development right now. So by both of them showing, by the first two showing that they have a strong efficacy, that is very, very encouraging. So yes, hopefully there will be, manufacturers will switch over to whatever vaccines are working the best. So that that is absolutely a light at the end of this tunnel, which is wonderful because there was a time where we weren't even sure if we would be able to get a vaccine. So this is really good news, but what people have got to do is make it to this point. So that means that they have got to really be vigilant this winter because right now we're in a position where people are just not being careful, a lot of them, and we're seeing the results of that.
And we will get to that in a second, preventative measures. But while we're still on the vaccine, I want, of course, medical professionals, nurses, healthcare workers, you and your staff, those on the front lines to get the vaccine first. Is that how it will roll out? And then in order of level of interaction with potential COVID cases?
It's probably, we haven't exactly seen the plan yet, but it's probably going to roll out like this. And just for the record, most of my staff are not direct client facing individuals. Although we've been working since, the very beginning of this, we work behind the scenes, not directly with clients. So we're able to do a lot of things safely. So who it will probably most likely go to first would be people working in long-term care and in hospitals and in clinics, places where they are absolutely going to be seeing and taking care of people who are infected. Then I would assume that it would go to people who are at higher risk of negative outcomes. So yeah, that would be probably starting first with elderly and then going to people with underlying health conditions. So that would be my guess. But that there's a lot of details to work out through that. We're already getting the emails from places saying we need to be put to the top of the line. That's to be expected. We got those with H1N1, but the fact is we will follow the plan and get the vaccines out first to those most at risk and then go from there.
Okay, I put the cart before the horse. So let's back up. We don't have a vaccine yet. We have widespread community spread right now. So tell us a little bit about the numbers here in Champaign-Urbana and the surrounding communities.
Right. Well, our entire region is just a mess right now. We have places with over 20% positivity rate in their county. Right now, we are at 772 cases in Champaign, although a bunch just came through. So it's hard telling what that is. But as of today, we've reported 772 active cases. Those are people in isolation. We have 12 hospitalized, but the hospitals are really getting near capacity. 12 are just from Champaign County. We have had 39 deaths, and we currently have 1,348 people in quarantine. So, as the numbers increase, the likelihood of people getting a negative outcome is going to increase as well. So we are starting to see more hospitalizations, more deaths as we see more cases. So we have got to get a handle on this. And, unfortunately, there have been some large weddings going on, parents doing things with their kids, such as homecomings and things like that, that really, people need to know better than to do this. They need to just think about the good of the community, and let's try to all, be vigilant and do what we need to do until we can get to that time where we have a vaccine.
You mentioned that hospitals are filling up. We have two huge, wonderful facilities right here in Urbana. Yes. What happens if they fill up? Then where does the overflow go?
Well, so the first step would be to limit maybe surgeries and things like that aren't urgent. And then they will start using, and they probably already have started using, expansion within their hospital And then beyond that, we would have to go to a field type hospital or a surge facility. There are plans for that. There always have been plans for that. But we have to remember there are still finite resources. I mean, we can put beds anywhere. That's not the issue. The issue is having the ability to staff all of those beds. So we have to really be mindful of that. And again, our county was doing a wonderful job, but it seems like now things have just been, people are just not heeding the advice in a lot of situations. And it really concerns us going into Thanksgiving because we know that there will be infections, hospitalizations, and deaths increasing due to that, because people really want to meet and they will do it and may not know that they're ill, and family members will get sick and some will likely die.
Nationally, it took us 100 days to get to 1 million cases at the beginning of the pandemic. Now it has taken us 8 days just to get to another million. What are we doing wrong?
We are not following the guidance. I mean, places are, there's a state mandated mask order. Champaign-Urbana does a great job with that. Other places, not so much. We have people who are still going to businesses that are illegally open. They're not supposed to be open during this. People are still going to them. People are still having weddings and parties and gatherings and doing things that just simply are not safe. We're starting to revert back more to the magical thinking that somehow you're magically protected, but in effect, people are not. And this virus does not care anything other than getting from one person to the next. And it will do that most efficiently when people are gathered close together indoors and not wearing masks and not distanced. And that's exactly what we're seeing.
Nobody wants to have to mandate a national lockdown. Dr. Fauci doesn't think there will be one. He thinks it'll be left up to the states. What will have to happen with our numbers in the state of Illinois to avoid a shutdown?
I would assume that it's going to all now hinge on hospitals being overwhelmed, because again, like I said, you can set up surge hospitals. You still have to have people to staff them. In the spring, it was easy for people to go, well, not easy, but it was possible for people to leave their jobs wherever they were in parts of the country that weren't on fire and go to New York and help out, or help out in Chicago or the different places. We're all now in the same boat. So there aren't going to be, there's not going to be some group of nurses and physicians and respiratory therapists coming in from another area to take care of us or to take care of, we're not going to be able to do that for other places. So it's really up to communities and counties and people to do the right thing and to get through this holiday season and to try our very best to not overwhelm our healthcare system. Because if we do that, then we're going to see people dying of other preventable causes, like they've had a heart attack, or they've had a stroke, or they've had an asthma attack, and they cannot, get in to get treatment because it is full. This is not something that we are used to seeing in this country at all. And the other thing would be if they end up opening surge facilities in other areas, we're talking maybe a 2 or 3 hour car ride or ambulance ride to get to these places. So, there is limited capacity. This is the same thing I've been saying since, March, but now we're really to the scary part of this pandemic, and people really have to pay attention to this because we do not want to go over that cliff.
What I'm hearing you say is that it's up to us to change
every individual to change your behavior and to not gather just because somebody wants to gather or because you're bored or because you feel like it's your right or you feel like, this is a hoax, or you feel like, you miss your grandma so bad you really have to do it. Because these are very critical times right now that we're going to go into for the next couple of months. And the only thing that we can do, the only thing we have is individuals following the guidance. They're not getting affected wandering through the grocery store, picking up their groceries when they're masked. This is people gathering. This is what we are seeing. Going to bars that should not be open, going to people's homes for parties, having birthday parties, continuing to have weddings like we're not in a pandemic. And this is like dropping a rock into a still pond. You have your initial infections at the site of the party or the wedding, then you have those going out through the families, and it just keeps expanding. And every super spreader event that we've seen, throughout the country, there are deaths linked to that. And they start with that individual party or wedding or gathering.
So 40% of people interviewed or tested said they're still going to get together for Thanksgiving with 10 or more people. So Thanksgiving is a week from Thursday, and then Christmas is in a month. So between Thanksgiving and Christmas, we could see the hospitals fill up because people aren't following the rules.
Absolutely. That's why we're, saying this at every single turn. And I've been saying it for months and months and months. When we did this, some of this silliness during 4th of July or, other things, a lot of it was outdoors. So it wasn't this bad. This will be bad.
Dr. Sanjay Gupta, he says the pandemic has become a humanitarian disaster in the US. What exactly does that mean?
This means that we are at a level of unprecedented and needless deaths in this country, hospitalizations. People are losing their homes. They are losing their businesses. They are losing, they are being evicted. They are waiting in hours and hours and hours for food to be able to feed their families. We are in a very much of a mess. We still don't have a national strategy. We're still waiting for money for people to help with rent and to help with utilities. This is a humanitarian crisis, and it's completely preventable. It is completely preventable. When we had to close things down and businesses had to shut, that's when the money should have come in, and the businesses that cannot remain open due to safety should have been made whole and been allowed to survive, and their employees should be allowed to, be paid basically to stay home. That is the kind of leadership that we have needed, and that is the kind of leadership that is lacking. Not to mention, the hospitals and other places that are filling up and staff are getting sick. And, we've lost so many healthcare workers during this too, because of lack of personal protective equipment. So it is nothing that we should be seeing in this country. We've always known we were going to have a pandemic. We've always known that. And we will have another one after this one, because pandemics are going to continue happening. It all has to do with how you prepare for them and how you act during them, and what the plan is and how it's rolled out. And this is where we are. So we have to get through this, but we're getting through it with way more suffering than was necessary. It's tragic.
You bring up the word leadership, and I'm glad you did. Nationally, we're a mess, but more and more people that I talk to feel a little comforted by the fact that J.B. Pritzker is at the helm of our own state, even more comforted that you're at the helm of our local public health crisis. Recently, last week at a briefing, J.B. Pritzker specifically praised you and your staff and the community for getting a handle on this. So what kind of communication, by the way, congratulations, of course you're getting statewide recognition, but what kind of communication do you have with the Illinois Department of Public Health in terms of communication of where we are with our numbers? How often do you talk?
We talk all the time. We have all kinds of meetings all the time. I talk with Dr. Ezeki, and anytime I need to, basically. But at one point it felt like we were doing a really good job, but right now it's not feeling like we're doing a really good job, because it is becoming overwhelming. And we may be doing better than the rest of the state, but really, what's that saying? when the whole country is like this, that's not good enough. It's not good enough. And again, we have more cooperation around here. We have more resources. We have everything. But we're starting to see places just, we're starting to see people just quit doing what they need to be doing. And we're seeing the results of that.
At the beginning of the semester, we were all bracing ourselves for an onslaught of students from all over the country, all over the world, potentially bringing the virus here, spreading it, and then we were going to take a sigh of relief at Thanksgiving when they all dispersed for 2 months. It's not really the students, is it? It's the surrounding communities that have gotten lax.
It is absolutely not the students. The U of I has a program in place. I mean, obviously there are a lot of student cases that have happened as well, and a lot of them brought it in, but they were able to be, contained, isolation, quarantine, and the massive testing. That doesn't exist everywhere else. And now we're seeing our testing lines at the mall get longer and longer, and the results taking longer and longer to get in. But again, the entire point of testing is a public health measure so that we can isolate and quarantine and do the contact tracing. So if those results aren't getting back fast enough, then that's not helpful for us.
Last question before I let you go. It's about Thanksgiving, our imminent family gathering holiday. I've seen it printed somewhere that if you avoid it this year, then you'll get to see them next year, that you won't have to go to a funeral between now and then. That's pretty dramatic, but in your words, how important is us to abstain from seeing family that we don't live with at this holiday?
Well, to be blunt, I wouldn't gather with anyone this holiday season that you mind killing, because unfortunately, as rude as that sounds, that's what we're talking about. Because I cannot stress enough that you may be infected and not yet know it. So anyone, you don't want to have a party or a Thanksgiving dinner with people you love and then find out, a couple of days later that you're sick and that you probably just infected everyone in that room that you love. And that's what we're talking about. That is exactly what we're talking about. It is something that you have to have in the front of your mind. Are you comfortable with that decision? Because that's what it could be. And there's no one that can take that away once it happens.
I want everyone to stay safe this holiday season. You, especially Jason Liggett, we wouldn't be able to do this without you. UPTV, thank you for your time. Urbana Mayor Diane Marlin, I know you also miss your grandkids. We're all doing what we can. We're making sacrifices. None more obvious than Julie Pryde. She is the administrator of the CU Public Health District. Julie, what would we do without you?
Well, what would I do without all the tons of staff here that are doing all the stuff? I want to just say too that, all through these holidays, my staff, of course, are going to be working as our healthcare providers. And I think that people need to understand that this is really hard on healthcare providers. This is hard on the nurses and the doctors and the respiratory therapists and the people working at all levels of healthcare to see this. These are people that are having to die alone. They can, the healthcare staff are, that has an impact on people. It has an impact on, doing this work day in and day out, and then seeing people basically squander their opportunities to control this virus and protect lives. It's a very stressful time right now. So definitely thank your healthcare providers. And if you really want to thank them, do what you need to do to prevent them from becoming overwhelmed.
Thank you for that message, and thank you for your time, Julie. Stay healthy.